725% increase in the amount of Medicaid spending for kids without Social Security numbers in Illinois just over the past 5 years. That's according to the latest Freedom of Information Act responses that a Statehouse candidate received from an Illinois agency. This is Illinois in Focus Daily. I'm Greg Bishop. You can get this program each and every weekday morning live, but also in segments, plus the podcasts, and get the headlines at thecentersquare.com. So I talked with Bailey Templeton. She says that there is a lot more to tackle about this issue she's been tackling for more than a year, and that deals with Medicaid spending on children, and in particular, the amount of Medicaid spending that's being spent on kids without Social Security numbers. So I chatted with her Friday after she shared some FOIA information she received back, and she lays out exactly what it is that she did get back from the state agency dealing with Medicaid spending.
In my FOIA request response that I just obtained from HFS directly, we found the number of DCFS enrollees who have no registered Social Security number who are also receiving Medicaid benefits. And that number in 2021 was 450, but now in 2025, we're recording 1,085 children. If that's not astounding enough that there's 1,085 kids in DCFS care without a registered Social Security number, I think the financial aspect of it might grab some attention for you guys. We're talking about $8 million. Sorry, let me grab my paper here. $8 million was spent in 2021 on children without a registered Social Security number in Illinois DCFS care. But in 2025, that total went to $66 million spent on 1,085 children from the documents I received.
Again, that's from $8 million to $66 million that has been spent from 1 year in 2021 to another year in 2025. That's a 725% increase in the amount of spending for Medicaid on children without Social Security numbers. Templeton talked about where exactly some of that money's going.
We've got inpatient hospital stays, outpatient hospital, pharmacy, social work. I kind of asked them for a vague breakdown, but 39 million of that 66 million was used for inpatient hospital stays for these children. And I would kind of question whether all of these children are sick or not, or what's going on there, and how can we ensure that our taxpayers are being fully accounted for through Medicaid and through the DCFS funding? What steps could we take to kind of fill in these gaps to figure out what's going on with these children? I think a child who is undocumented or without a registered Social Security number is put at a very substantial risk for a lot of things happening for that child. Human trafficking is a big issue that we need to tackle, and a lot of people need to start talking about it to bring attention to the system. But I do believe that there's something going on here with these numbers, that we've been told that children without Social Security numbers are not on Medicaid, but HFS's own records prove differently.
So Templeton, looking at these numbers, requesting data from state agencies that deal with Medicaid, and in particular, she's looking at the cost of Medicaid for children without Social Security numbers. And previous FOIA responses she's received from state agencies also highlight that there are 20,000 children the state is dealing with that do not have Social Security numbers. Half of those are 0 to 1 years old, but the other half is 1 to 18 years old who don't have Social Security numbers. So those numbers, she says, doesn't really mash up with previous data she received about kids and no Social Security numbers being impacted by the state government.
Oh, great question. Well, my original question to HFS was how much was it costing for the 20,358 children without a registered Social Security number? And when I found out that only 1,085 of them are in Illinois DCFS care, it raises questions about the other 19,000 children and whose care that they are in and who is overseeing the hospital treatments. I mean, if it's roughly $40 million spent on inpatient treatment, that's a lot of time for children to be in hospitals. I do want to reference federal cases that are on the docket right now about Illinois DCFS leaving children in psychiatric hospitals for extended periods of time. This doesn't point to psychiatric hospitals specifically, but it does say long-term hospital stays for these children.
One question I had asked Templeton, again, somebody who's running for the Republican primary in the 94th Illinois House District, and that primary coming up March 17th, she says that she's focusing on kids without Social Security numbers, not necessarily because of the immigration debate that is heated up all across the country, including right here in Illinois, with the state already spending billions of dollars on health benefits for non-citizens. She says that's not necessarily why she's looking at the children without Social Security numbers when it comes to these types of spending lines.
I would say that I think that every child in Illinois should be taken care of and respected. And one of the biggest steps to making sure that they're taken care of and respected is to make sure that there is oversight to what's happening to them, especially when they are involved in state agencies that have shown misconduct and misuse through other exposed FOIAs and other documentation like the intern investigations. My question would be how these 1,000 children ended up in Illinois DCFS care, and kind of just having some skepticism over the safety of what's happening to them when they are unregistered in the Social Security program. It's not about attacking children and trying to take away their health care by any means. It's about making sure that these children are safe and that whatever's happening to them is by the law and by the books and the way it should be.
And the issues that she raises tend to get a little bit in the territory of dark. She mentioned earlier human trafficking concerns, and she goes a bit further to talk about medical trafficking concerns.
Sure. I think it's a wide spectrum of things that could be happening here, and it wouldn't be right for me to say exactly what's happening, but I could say it raises questions about what would be called medical trafficking, where things are conducted onto children when they're too young to be able to consent to these things happening. I can't prove what's happening to these children, but there are reasons that the Nuremberg Code was written the way that it was, and children can't consent to what could be happening to them. And yes, it is a really dark side, but there are really dark things happening in this country and across the world, and we are all aware of that. And it's very important to bring light to the dark because they can't coexist. So if we continue to shine a light on things that could be harming children, I have hopes that we could solve this and protect more children. Whether they are registered Social Security number holders or not, I want to make sure these children are safe.
And the issue, obviously, something she says needs more transparency and needs more coverage, not just from media, but also from legislators and people who do oversight.
We need to make sure that our funding is going to where it needs to be, not to... There could be fraudulent Medicaid charges. There could be so many different aspects to this situation that we just need transparency so there's not so many what if questions. And we need lawmakers and we need the people to start asking these questions so there can be enough coverage to change it.
And Templeton also saying this all is under Governor J.B. Pritzker's administration from 2021, $8 million up to, in 2025, $66 million.
I think the taxpayers deserve answers, 100%. We are paying for everything that is coming forth through this overpayment system. That's coming from your money that should be going to you and your family directly. I think that state agencies have way too much power and that they have way too little oversight. And this really does fall on the lap of Pritzker. Once again, he is allowing his state agencies to break the law, to break constitutional rights, and to do things that are really obscene and unheard of. And Pritzker's got to go. It's just the bottom line to it. He's got to go. He does not have the morals that it takes to be a governor, to follow the laws and to keep our children here protected.
Again, Templeton is a political candidate that's running for the Statehouse in a Republican primary. She also said that she's going to continue fighting to get more information on these issues and taking different avenues as well to find accountability for children in the system. And she says she's been working on getting this data for well over a year.
So there is a lot of pushback from the agencies, which they're not allowed to have with FOIA. FOIA was created pursuant to the Constitution, meaning it follows the Constitution. You have to keep all of the constitutional protections with FOIA. And if they continue to break those, they will be held liable for the things that they're doing. There's FOIA court where you can take them and force them to give you the information, but it shouldn't have to come to that. It should be immediate transparency. Everybody should want to collaborate and work together to solve the problem. And the fact that there's any pushback at all is super appalling. It shouldn't be that way.
So Bailey Templeton, I think we'll hear more about these issues from as she continues to delve into the data, and in particular, the demographics of the kids without Social Security numbers getting Medicaid services. And it's going to be difficult to, I guess, in a way, determine just what kinds of procedures were done with some of this money because of various, privacy laws and such when it comes to medical information. So a lot more to come about this. Obviously, we'll see what state legislators are doing. A previous story that Templeton led was an issue about the number of missing kids at DCFS. And some legislators looking at having more transparency with that by passing laws. So we'll see just exactly where this goes. Again, you can wake up with us here with Illinois in Focus